Hello, my name is Tanaya Coleman, and today I will be presenting the presentation part of my disease project for my microbiology lab class. For my disease project, I chose measles as my disease to present. Measles. The scientific name for measles is rubeola. Measles is caused by a single-stranded envelope RNA virus with one serotype. It is classified as a member of the genus Morbillivirus in the Paramyxoviridae family. Structure of measles. The nucleocapsid consists of the ssRNA surrounded by the nucleocapsid and the phosphoprotein and a large protein that function as polymerases. And I also have a picture of it. Life cycle of measles. Following the amplification in the epithelium, the virus is released onto the respiratory tract. The incubation period of measles from exposure to prodrome average from 11 to 12 days. The time from exposure to rash onset averages 14 days with a range of 7 to 21 days. The prodrome lasts 2 to 4 days with a range of 11 to 7 days. 1 to 7 days, I'm sorry. How is measles acquired? Measles is a highly contagious disease caused by a virus. It spreads easily when an infected person breathes, coughs, or sneezes. Measles can affect anyone, but is most common in children. It can cause severe disease, complications, and even death. Mechanism by which measles causes disease. Measles infiltrates and grows within the epithelial cells of the pharynx and lungs. Its mode of transmission is mainly from person to person by dissemination of droplets of phloem through the air. Measles virus can infect several different kinds of cells, including epithelial, endothelial, and immune system cells. Immune cells infected by measles virus include immature lymphocytes, T and B cells, activated monocytes, macrophages, and mature dendritic cells. Signs and symptoms. Signs and symptoms of measles include cold-like symptoms such as runny nose, sneezing, and a cough, sore red eyes that may be sensitive to light, swollen eyes, watery eyes, a high temperature, which is a fever, which may reach to 104, small grayish white spots in mouth, aches and pains, loss of appetite, tiredness, irritability, and a general lack of energy. Diagnosis of measles. A doctor will suspect measles based on the common symptoms including fever and rash, and especially if the patient has recently traveled internationally or was exposed to someone with a fever or rash. Laboratory blood and tissue tests from a throat or nose swab can confirm the diagnosis. Detection of specific IgM antibodies in a serum specimens collected within the first few days of rash onset can provide presumptive evidence of a current or recent measles virus infection. Treatment of measles. There is no specific treatment for a measles infection once it occurs. Treatment includes providing comfort measures to relieve symptoms such as rest and treating or preventing complications. Medications that can be taken to improve symptoms include fever reducers, antibiotics, and vitamin A. Prevention of measles. Community-wide vaccination is the most effective way to prevent measles. All children should be vaccinated against measles. The vaccine is safe, effective, and inexpensive. Children should receive 2 doses of the vaccine to ensure they are immune. The impact of measles on humans. Before the introduction of the measles vaccine in 1963 and widespread vaccination, major epidemics occur approximately every 2 to 3 years and cause an estimated 2.6 deaths each year. Did you know that one person with measles can infect 12 to 18 people, making it one of the most infectious yet preventable diseases? 9 out of 10 susceptible people who are exposed to measles will get sick. And we call susceptible people those who are unvaccinated or have never had measles before. Okay, and that was the end of my disease project. I have a resources page. For my disease project, I used the CDC, Centers for Disease Control and Prevention website. I used the World Health Organization website. I used the National Institute of Health website, and I also used the Mayo Clinic website. And all of the pictures and graphics in my presentation comes from the Canva app on my computer. Okay, thank you for your attention, and thank you for viewing my PowerPoint, and thank you for listening to me present my PowerPoint. I hope you